Regarding atrial fibrillation and the risk of recurrent stroke and mortality, overall, the risk of recurrent ischemic stroke, intracranial hemorrhage, and mortality in people with atrial fibrillation detected after stroke is still unclear compared to people with known atrial fibrillation. So what we did is a systematic review and meta-analysis of studies that investigated the difference between these two types of atrial fibrillation, the one detected after stroke and the one known at the time of stroke. So overall, we included studies published up to the 2024, and we had a systematic procedure. So we included cohort observational studies and randomized control trials, and excluded studies with less than 15 patients per group. We assessed eligible studies for bias using the Robin-Z tool, and we pooled study-level results through random effect meta-analysis of risk ratio. Overall, we included 17 studies with more than 113,000 patients and 49% female. Interestingly, 8 of these 17 studies had low risk of bias, so this gives some robustness to our estimates. The ischemic stroke recurrence was significantly lower in the atrial fibrillation group detected after stroke, so AFDAS, compared to the known atrial fibrillation group. And this was significantly lower with a risk ratio of 0.79. The meta-regression analysis revealed no specific interaction of anticoagulation, CHA2DS2-VAS score, or sex on the difference in risk of recurrent ischemic stroke between groups. This means that this difference seems to be very much consistent on the grouping, so on the AFDAS group and CAF group. This means that AFDAS overall may carry a lower risk of ischemic stroke recurrence and mortality compared to known atrial fibrillation with similar risk of intracerebral hemorrhage. So stratification through implementation of atrial fibrillation burden measure may support more personalized management for people with atrial fibrillation detected after stroke.